Botox to cure COVID, long COVID symptoms in terms of taste and smell, as well as possible other causes of taste and smell dysfunction sounds crazy. Well, it sounded crazy to me as well until I actually managed to fix this situation. Right now, if you're going to ask me the question, I'm not ready to reveal how I do it. But this is something that I'm really, really proud of. To me, a massive discovery. If you ask me, how did I figure this out? So what's interesting is I was doing a treatment for migraines, and I was able to actually have the patient breathe better from it, which was really odd. And that's another video I'm going to shoot. Is I really believe I've been able to solve rhinitis and sinusitis issues as well. But I treated this. I had a patient come in with really bad allergies, and I injected him, and his allergies went away immediately, 1 second later. And as I said, I'll talk to you about that in a different video. And then I had one of my staff members have the same obstruction issues, and I treated her, and she says the first time she could smell in 10 years. So I said, well, wait a second, I wonder if this is just the fact that she's been blocked for 10 years and can't breathe, or is there a neurologic release here? So I treated, I had a patient come in with long COVID, and I treated her, and she told me that coffee smells, she did a testimonial for me, coffee smells really off, it smells like garbage to her. And I did it, and she could immediately smell coffee again. And then I did a little bit of a touch-up for her, and she says now her taste is normal as well. I had a 77-year-old lady that came in who was hospitalized for COVID a few years ago, and I treated her with the Botox, and she said her biggest issue wasn't the smell, but the taste. Her Diet Coke for her tasted like bitter, and so I kept on treating her over a few minutes, and she went from 40% bitter to 40% sweet to 60% sweet, all the way to 100%. And then what's interesting is then I had another lady with long COVID I treated, and she said that coffee smells like roach bait. I don't know what roach bait smells like, but I put the coffee pot underneath it, and she said, yeah, it smells like roach bait. I treated it again, and I treated her, and she said it smelled like coffee. So I'm very confident I can fix taste and smell. I actually had a lady that had a pituitary tumor 30 years ago, and it was resected, and she has not been able to smell for 30 years. I was able to treat her, so nothing to do with COVID, and she was able to smell. For the first time, she started to cry because she hasn't been able to smell in 30 years. So I'm very convinced I can really normalize taste and smell in almost anybody out there. I'll continue to give you developments and feedback on terms of how things progress for you. I'm treating traumatic brain injuries coming up. I've got all different ways of treating things. But I will tell you that I'm convinced that my method will solve the dilemma of taste and smell issues for patients of all different stripes out there. The natural question is, how long will this last? I don't know. And I will tell you my guess is it's either a permanent change of the neurologic realignment, or it's going to last 3 or 4 months. And then, as like I've seen for a lot of the treatments with Botox, is that after a few rounds, it just becomes permanent. Like I've fixed people with chronic neuromas that from bad surgery that have lacerated nerves. I've been able to fix that permanently after 5 rounds. So very confident for a long-term success with these therapies, but I wanted to give you an update on this.